Okay, no problem.
All right. Good afternoon, and Dr. Dapo, how are you today?
I'm fine, thank you.
All right. For those of us, for those listening at home, I have with me Dr. Dapo Adegbaju. He's a consultant psychiatrist at the Federal Neuro-Psychiatrist Hospital in Yaba. He's also a member of the executive of the Nigeria Medical Association in Lagos. Dr. Dapo, thank you for joining us today.
You're welcome.
All right. Doc, quite a few things, like you're aware, over the last few weeks, we've been trying to do this thing called Can You Fix Nigeria? The challenge. And we're talking about various sectors about across Nigeria. We're looking at our security issues. We're looking at our health sector issues. We're talking about education. Today, we're going to be talking healthcare with you. And where do you see the state of healthcare delivery in Nigeria today?
Well, thank you. The state of health in Nigeria is a little bit in the precarious state.
Okay.
The problem is multifaceted. It has to do with a lot of issues ranging from funding to lack of equipment, lack of human resources, not too good policies by the government, and so many others. And I would like to take it one by one. Let's start from lack of policy and budgeting.
Okay.
We know that all over the world, health is not that is cheap. You need to have good investment in health for your population to be healthy and then for them to become more productive. The specified percentage of the budget for health is usually put at 15%. But in Nigeria, the budget hardly goes beyond, the best we've ever had is about 7 to 8%. Majority of the time, it hovers around 5%. And you know, this now leads to a lot of underfunding. Just a few weeks ago, the resident doctors in Nigeria had to cry out for funding, and it had to take a lot of political maneuvers before 4 billion could be injected for their funding. This is something they've been crying out for quite a long time. And then another thing, the resources are now scarce. Another problem is wastage. When we don't prioritize what we need to in the health sector. I give you a typical example. Because of political consideration, some people might cite some health facilities in their hometown when it is not advantageous to the people in that locality.
I see.
Because they want to have something to point out. All this. Then lack of human resources. Despite all the various professionals being churned out in large numbers, what do we have? We have majority of them leaving.
Correct.
Because they are unemployment. And you know, when the person who has suffered and labored through school has now come out of it and then there's nobody to employ him, of course, you have to take the easiest way out.
Okay.
And that's what we call a brain drain.
Brain drain. Fantastic. In fact, you're absolutely right, Doc, because those are the issues I wanted to take. So let's take it one by one, like you rightly said. Okay. So the first thing you talked about now is the issue of funding. And where we're talking about 5% of our budget. Yeah. Okay. So 5% of our budget, I guess that comes to our budget this year was about 13 trillion, I understand. So 5% of that comes to about 650 billion naira, which is less than $2 billion for the entire population of 180 million. Now, I worry about that because first, you need to pay the people doing the work. So once you have paid them, you don't have a lot left. 2 billion is not enough to manage healthcare delivery in Nigeria. So what can be done to correct that situation? And if we cannot correct it, how can we focus on making the best of a bad situation? Did you get the question, Doc?
How can we?
So
the question again?
Yes. So my question is, if we don't have enough money How can we optimize the little that we have?
Good. Now, we need that's where we need to be sincere to one another. I mean, sincerity of government and sincerity of even the purpose. We need to be sincere. Now, the government have some faults. The people also, we also have our own faults. We need to tell ourselves some basic truths here. The government is lacking in their own responsibilities, while maybe because of the policies also, the populace too are also doing things that are not benefiting the system. I'll give you a typical example. We always cry out that there's the human resources is a little bit not adequate. But even the ones that are employed, we have some of us that are not even going to do the work. We need to say the truth and say it the way it is. So if you don't put your own effort, I mean, it's not going to show. We have primary healthcare centers where this is the basic unit for health in this country.
Correct.
It's supposed to be at all local government levels. You go to some primary healthcare centers on the personnel. You go there on inspection visits, you find that the sincerity and the insincerity of the populace, of even the workers, come into play. Some people want to collect the money, they don't want to do the work. And if you don't do the work, it is going to impact on the people you are supposed to serve. That's for the populace.
Yes.
On the government, however, you see, that's why I said citing projects in places that are out of place. I mean, if because you want to be a good person, you cite a project in a place that is not accessible, I mean, how do people get there? So at the end of the day, it's going to amount to a waste because people will not patronize it. And at the end of the day, all the money put into that project will be a waste. So we need to get to ourselves. We need to do, and this is where data comes in. With the paucity of funds, we need to have data. Now, what do data do? It lets us to know the health indices of a particular set of people. Okay, in this local government area, there are X number of people there. This is what they will need. Where will be the place to site a primary healthcare center that is going to be accessible to virtually everybody in that local government, not just a particular set.
I see.
Data is important.
I see.
We need to put data down.
Yeah. Okay. But let me come to this issue of the brain drain. Let me come to the issue of this brain drain, because I think now, as long as I can remember, when Professor Lukoye Kuti was health minister, people have been talking about brain drain. Do you understand? Now, I know I cannot tell you how many of our friends now I know are in the UK or in Canada, doctors who went through our system, who now have 20, 30 years experience under their belt and should be helping the healthcare delivery in this country, but they are elsewhere. So what can we do to reverse this trend? What can we do? Now, I will take this question, and Doc, I want you to be frank with me because I want you to look at it from two ways. It's not only that we're losing these resources in terms of their experience, we're also losing money as a country because we're training people, we're giving them training at very subsidized prices, and they are going to other countries to benefit those countries. What can we do to address this?
Now, thank you very much. This is where the government have to put on their thinking cap. Why are people moving out? It's because they are not employed. Now, I have majority of my own classmates who have gone through the rudiments of residency. They're practically in the UK today. In fact, I can tell you that where I live, Federal Neuro-Psychiatrist Hospital, Yaba, has more psychiatrists in the UK than even in Yaba itself. It's surprising because the government does not deem it. I mean, I don't know how to put it. Is it that we are not serious or we don't want to benefit from what we've labored for? You spend millions to train people and you allow them to go for free to other countries to go and help the system of that country. So what I feel the government needs to do, look, we need to cut down all these excessive things we do in this country. Look, if we have to be sincere, the budget of the country needs to be put down. Education, health, push more money into those areas.
Yeah.
Like I say, once you invest in your education, you invest in health, we are going to have a healthy population that is going to increase the gross domestic product of your country.
Correct. Okay. Let me
what
take.
do we need to do?
Oh, please go ahead. Please go ahead. Go ahead.
What do we need to do? All this, look, as I'm talking to you now, there's a policy called the mental health gap in the country. And what is this gap? We are talking about there are not enough professionals to man the various hospitals in the country. Why is this so? In sincerity, government will employ 2 people and want the 2 people to do the work of 10 people. No, it will not go well. Employ people. If you invest in people, you will get the benefits. All these people running, if you employ them, some people are running not because they want to run outside the country, but because, look, they have mouths to feed. And if they remain unemployed, where would the money come from? So it's a matter of economics here. Employ them. Once you employ them, employ people at the primary healthcare level. You will see the changes in this country. Employ people, employ professionals, get them well paid. You will see the output and not show immediately. But we are talking of 5-6 years down the line, you will start reaping the ripple effect.
I see.
Yeah.
I see. Doc, let me touch on another issue that has always been that always touched my heart. You just mentioned about resident doctors going to government and asking for more funds. One thing that always surprises me is the number of strikes that we have. Do you know, in the last 20 years that I remember in Nigeria, there's 2 things that are common trend. ASU will go on strike, doctors will go on strike. Yeah. You understand? And I don't know why. Yeah. 2 or 3 years ago, I saw that the junior doctors in UK went on strike. It was their first strike in 60 years. So why do we have such a big differential? What is driving that, and how can we correct this? Because it's not normal, right? Is it?
It is not. Now, thank you. You see, insincerity. Now, you go to negotiate with these people. I mean, we are talking of ASU. We are talking of an agreement that was reached maybe 15, 20 years ago, and is not yet being implemented. We live in this same country where these politicians are, where they appropriate more monies to themselves, and then you will now be looking at, ASU is practically begging for maybe 30 billion. Meanwhile, in this same country, you are appropriating billions for rehabilitation of the National Assembly. Look, we are all stakeholders in this country.
Correct.
You can't be reaching an agreement with some set of people and then not making that agreement to come to fruition. And at the end of the day, they are seeing where.
Hello? I think I lost you there, Doc. I've lost you.
Bear fruits, because doing cannot bring back life.
I see.
You cannot bring, once life is lost, you cannot bring back. So, I mean, I've learned some in other countries, other workers go on strike for doctors. Doctors will go on strike on your behalf.
Correct.
To force the hand of the government. To force the hand of the government, because you are no one knows who is next. It might be the person whose wife is having an obstructed labor that needs to be operated. And if the child is not operated, you know what that means. The mother can die, the child can die. I mean, if the child survives, the child, because of inactivity, might end up with cerebral palsy. All these things come to bear on the long run.
Let me ask you another question, Doc. Another problem that I've been seeing of late, which is the problem of drug abuse. Do you understand?
Yeah.
About 2 years ago, I was somewhere in Lekki, and I had over 100 or 200 Okada people parked. You know, I don't know where all these people come from. And there you could see people, everybody had something. You know, it was surprising. I'm saying right in the middle of Lekki, right in the middle. Do you understand how many people are using drugs? They're using drugs openly. I cannot. So what brought us to this situation, and how can we address it? Because it's a big problem. I don't think people understand this problem yet.
Thank you, Kuli. Multifactorial too. We need to tighten our regulations. The laws tighten. We need to tighten. As of today, marijuana is still illegal in Nigeria. But
Okay.
what do you have? It's virtually everywhere. The law enforcement agents that are supposed to prevent all these things being sold are even joining in the fray. So what happens? It's a free for all. And at the end of the day, you know, the world is now turning into a global village. Now
Correct.
people can order online. Things can be flowing through any all these courier services. I mean,
Correct.
and it's becoming so that are even foreign are coming into the country. I mean, gone are the days. Nowadays, if we are not careful, there are some drugs going around now that looks like sweets.
Yes, I've
And
seen
if
those.
you're not careful,
I've seen
you will
those.
think they are sweet, and then you will take, and then the person goes bonkers.
Yes, I've seen those.
The scourge of drug abuse is so rife in Nigeria that if we are not careful, we are going to have a pandemic very soon in this country. People have graduated from smoking marijuana to purer forms. There's a purer form called Arizona, Colorado. These are purer forms of cannabis.
Wow.
We are talking of 40 to 50%
Purity.
pure.
Yeah.
Purity now of cannabis. People have gone ahead, all sources, tramadol. Tramadol, ethically, for a medical person, is between 50 to 100 milligrams. I have seen tramadol of 256 milligrams per tablet, and one individual will take 10.
No. Are you serious?
I'm telling you, these are practical things we've seen. People go to the extent of sniffing gas from sockaway, petrol, gum, nail polish.
Nail polish. Okay, so
I mean, there was a time,
2
years ago, codeine was the in thing. Codeine was the in thing, practically in the north.
Yeah.
Housewives, in fact, you find a majority of codeine addicts in the north were women. It is in the south that it is men.
I see. But Doc, what is driving this? Is it just the economy of the country? What is it? When did we become a nation of drug takers? How did this happen to us?
So many things, we've not tightened our regulations.
Okay.
I mean, Nigeria is a country whereby you go to some, let me start with the pharmacy or the selling of drugs outlets.
Correct.
The PSN is trying. They are trying to rectify all these chemists, people who are not authorized that are selling drugs.
Selling stuff.
They are trying their little bit. Yeah. But where you don't have professionals, where you see somebody who is not even qualified to sell drugs is selling it.
I've seen people carrying things on their head and selling drugs. Yeah, I've seen that.
Exactly. Where did they get the license to sell all those? That's where it comes from. They are non-eligible. Their own practical aim is to sell the drug and get money. They don't want to know about the effect.
I see.
That's where we need to tighten our regulations so that drugs that are not authorized for sale is not just there in the open. These Rohypnol, all these tramadol, they are supposed to be under strict regulation with prescriptions.
With prescription, I see.
Yeah.
Okay, let me take you up on another issue that's always bothered my mind. I seem to recall that under the government of General Abacha, they instigated what was known as the NHIS in Nigeria.
Yes.
Where are we with that policy today, and what is happening with it? Because I'm surprised in the US, in the UK, everywhere around in the civilized world, you have something like that. We instigated this about 15 years ago. So what's happening 15, 20 years ago? Where are we with that policy?
Yeah, Pule is unfortunate. NHIS, at least we copied it from somewhere. And if we copy it well, it's supposed to be as beneficial as where we copied it from.
Correct.
But lo and behold, the Nigerian factor usually comes in. No one. It is only the people working with government that the NHIS has been able to capture, and not even everybody. That is one. So we are talking of people still left out of the net to be captured. If people are well captured, reduce all this out-of-pocket payments.
Correct.
To access health. So what do you now have? Apart from that one, then we now have embezzlement, the usual Nigerian thing. I mean, I'm sure you are aware of where the executive secretaries of the NHIS have been suspended because of fraud. Like 2 of them have been indicted. I mean, instead of pushing the money into the healthcare system, they are buying cars, they are buying luxury items. I mean, this is not what the fund was meant to be. I can tell you for no fee, there are some of my friends who are private practitioners who are from enrollees on the NHIS. They have not been paid their capitation for quite some time. So how do we expect those hospitals to keep on functioning?
Correct. I see. But what can we do to correct this? I mean, Doc, because for me, I mean, I lived in the UK. I know what the NHS does in the UK. Do you understand?
Yes.
This will have helped us a lot as a country. How can they resuscitate it? Because I don't even see people talking about it anymore.
People are talking about it. It's just the normal thing, that the way things normally go in Nigeria. You talk about some things for a while. After a while, it's swept under the carpet because another major occurrence will have outshone that one.
Okay,
you know what I mean?
I see.
So we end up talking about the current one while sweeping the other one under it.
Oh boy!
Look, we need a reorientation in this country. That's what it boils down to. We need a lot of reorientation, and we need to be faithful to this country.
Yeah,
I believe if people are well oriented, and look, I'm not doing this for myself. I'm doing this for the country, for my fellow human being.
Correct.
This issue of trying to amass wealth or trying to corner everything to yourself needs to stop.
It has to.
Look, there's no point building. If you go to some areas in Lagos, some areas in Abuja and Lagos now, there are buildings, there's nobody living there.
A lot.
So
a lot.
How does it pay? How does it pay anybody? I mean, we amass so much wealth to ourselves, forgetting that our neighbor is going to affect the next door neighbor. We need to stop all this mentality. We need to be selfless. We need to be altruistic in it. Because we can't just be blaming our leaders too. We need to also put ourselves the lead, because it's a two-way traffic. There's something I posted on Facebook these days. They say Nigerians want a new Nigeria, but even Nigeria deserves new Nigerians.
Correct. I see.
Because our leadership is a function of ourselves.
Of who we are.
Of our thinking.
Exactly. I agree with you on that.
We cannot import people to come and rule us from abroad. It is still within ourselves that will put somebody there. We need to change our thinking for the good.
Let me ask you another question. Yesterday or so, I was watching the commissioner in Kogi State, and he was where he was talking about all the equipment that they lost, MRI scanners and things like that. You know, I don't want to go into the nitty-gritty of the commissioner.
Yeah.
But you know what surprised me? I know that MRI, for example, is not something that is very common. I mean, maybe exactly, not a lot of our hospitals have those kind of equipment. What can we do to bring in the appropriate equipment into our hospitals, and how do we maintain them? You understand? I remember, yes, go ahead, please.
Kunle, like I said, until we change our orientation, look, I can tell you for no fee. In my hospital, there is an MRI.
Okay. It
was brought into our hospital about 5 years ago, and it has not functioned for one day.
But why?
God bless you. Now, there are two ways. Now, the union.
Okay.
Hello?
Yes, I'm with you.
The union.
Yes.
Yeah, the union that, there are some people, various unions in the hospital.
Correct.
Who felt, they felt they needed to be trained so that they can use it. Now, management wanted a situation whereby it's a PPP, whereby you give it to people who are going to run it profitably, and then they'll be remitting money to the hospital coffers.
Correct.
But the union said no. So up to today, there's a stalemate.
No,
so,
but Doc,
I'm telling you.
But Doc, why can't we fire those kind of guys? Why can't we fire that person?
And you know the way it goes in Nigeria, Kunle. Number one, most of these people I'm talking about, they are senior people. You can't just fire senior people. You have to set up a board of inquiry, you know, all these things. And you know the way it goes. You have to talk to somebody high up. I know it could be really, really frustrating. I know a former medical director of my hospital tried his best to force his way. It didn't work. And that is the kind of mentality we need to change.
Wow.
Look.
5 years, you said. 5 years, you said. 5 years. The equipment was there, but they didn't use it.
Quote me, 5 years. Yes.
Okay. All right.
Not for one day.
Okay. So
when we are talking, you see, that's why I said the government has the share of the blame. The government has the share of the blame. The people have his own share of the blame. Are you getting it?
Yes.
So
yes,
at times when you talk about the government, we need to be sincere. Government too can do its own part, but we also, the people, need to do our own part.
All right. Now let me ask you. Yeah. Let me ask you one thing, Doc, because I want you to bottom line this for us. Assuming that there was no constraint on your side, let me say they appoint you as an example, health minister today. Yeah, and there was no constraint on your side. How do we fix our health care sector? What will you do?
Yeah. Now the reality, Kunle, is that, look, the health sector in Nigeria we have right now, we must do what we call the government side and the public-private partnership. That is the truth right now.
Okay.
Look, there are some of the businesses being run in the hospital that can be pushed very well by private individuals. And what the government needs to do is to regulate.
Okay, clear. That's very clear.
So that it won't be as if they now, put the cost of services way what the masses can afford. Because the truth is, Kunle, if you and I have an equipment, I'm sure we will want to make profit out of it.
That's the only reason we invested in it.
That's the essence of business.
Correct.
Exactly. But you see, once it's a government who puts an equipment there, there's this nonchalant attitude that we put up. So if it gets bad, they won't service it on time. If it gets bad, it's nobody's business. You know, there's this thing that is in non-government equipment. So at the end of the day, you find out that we are also the ones killing ourselves. If we take government things the way we take our individual businesses, I'm sure we'll make headway in this country.
We will.
Things are going bad. Okay, you see, look at this equipment. Because it is provided by the government, it has a fault. What stops you from reporting that fault almost immediately to the authorities?
Exactly, and let somebody come and fix it. Yeah.
Exactly. What you now have is that it will not be reported early. When it's reported, bureaucratic bottlenecks, they have to give it to a contractor. You know the way it goes. You know, contractor, something that 20 naira will fix. We'll be looking for a contractor that is going to take 500 naira.
Mm-hmm. Because you need to set up the procurement strategy and everything.
But if it's your own private equipment, I'm sure within 20 naira, please go and fix this thing.
Fix it straight away. Yes. So
exactly,
this is where I agree with you. This is where I agree with you. You see, in a bid, and I see this not only in the health sector, Doc. You see, where I work in the private sector, we have what they call a DUAG, which is a delegation of authority, which tells me, look, Adekunle, you can spend up to 5,000 or 10,000 without going to any authority. Do you understand?
Exactly.
We need to bring something like this into the public sector so that if you have a medical director, you can authorize that medical director to say he can spend 5 million without going to anybody to fix issues which affect his hospital.
Exactly.
So I don't know. It looks like we're in a deep mess at the moment, and I want to continue to engage people to come back and discuss some of these things. We will be calling on you to help us discuss some of this in the future as we are bringing up. But thank you for being with us today. We will be inviting you to share with us again some of your experiences from the hospitals in the coming weeks. Thank you very much, Doctor. Thanks.